Hello everyone, my name is Lissette Suriel, and today I will be presenting a patient evaluation in a clinical test presentation focused on glucose determination, kinetic, and urinalysis. Let's begin with the patient history, subjective, objective data, and hypothesis. We have a 17-year-old high school student. Um, he weighs 142 pounds. He was taken to the emergency room complaining of feeling nauseous and sore all over his body related to intense physical activity. His mother told the ER he seems confused after coming home from practice. His blood pressure was 145/92, and he is 5 feet 10 inches tall. Subjective data if the chief complained. The reason why the patient went to the emergency room. For example, in this case, he went to the emergency room because he was feeling nauseous, and also he was complaining of soreness all over his body. The objective data is the value that we can measure. For example, in this case, 142 pounds, the blood pressure, and his height. The hypothesis, I suspect dehydration due to intense physical activity, possible electrolyte imbalance. Before presenting the values of each test, let's talk about the role of clinical testing diagnosis. Clinical testing diagnosis serve as a valuable tool in the diagnostic process, providing healthcare providers with essential information to guide patient care, treatment decisions, and research efforts. The role in screening, diagnosis, monitoring diseases, prognosis, differential diagnosis, and research are critical in improving patient outcomes and advancing medical science. Let's begin with the clinical test presentation, glucose determination. Glucose is the simplest form of carbohydrate, and upon digestion, polysaccharides and disaccharides are converted to glucose, which is absorbed into the bloodstream. When our glucose level rises, the pancreas springs into action, releasing a hormone called insulin, which is like a key that unlocks our cells, allowing glucose to enter and be used for energy. So under normal conditions, blood glucose level is 70 to 100 milligrams per deciliters, and under abnormal conditions, such as hyperglycemia, glucose levels up to 800 milligrams per deciliters, and hypoglycemia, glucose levels drop to as low as 20 milligrams per deciliters. For determining glucose levels are the Benedict test and the glucometer. With the Benedict test, we use a urine sample and add a Benedict reagent. The Benedict reagent contains copper. As you can see, the chemical formula right here, which reacts with the aldehyde functional group, forming a brick red solid copper color right here, like this one, in the presence of high glucose level, and a clear blue in the presence of no glucose. With the glucometer, we prick the finger and take a small portion of blood and add it to the glucose strip right here. The designated area of the test strip react with the glucose in the blood using glucose oxidase and oxygen to produce gluconic acid and hydrogen peroxide. The result of the oxidation is the value that we will get in the glucometer. Kinetics is the study of the rate of chemical reaction and how they change over time. In the clinical settings, kinetics can be used to determine the effectiveness of drugs, enzymes, and other substances in the body. We're going to analyze two enzymes, CK and LD. They both associated with cell metabolism and energy production. Abnormal levels of CK are related to MI, MD, muscle injury, brain damage, pregnancy, intense physical activity, advanced aging, and overexposure to sunlight. Abnormal levels of LD are associated with rhabdomyolysis, myocardial infarction, muscle dystrophy, drugs, alcohol, muscle injury, cancer, and emphysema. You can see right here the normal reference range for the values of CK and LD. Urinalysis is a test that examines the physical, chemical, and microscopic properties of the urine. It can provide valuable information about a person's overall health, including kidney function, hydration levels, and potential infections. We can also measure the pH. Right here is an example of acidic urine potential causes and alkaline urine potential causes. Specific gravity of urine is a measure of the ability of the kidney to concentrate or dilute the urine. The range of specific gravity found in a healthy adult is 1.005 to 1.0030. An increase or a decrease in the specific gravity can be a sign of underlying conditions. We can also look with a urine sample for inorganic ions, ketones, proteins, and urobilinogen. In the test for ketones, we can add 2.4 dinitrophenylhydrazine in 94% ethanol. If precipitated is formed, the result will be positive. For protein, the urine needs to be boiled with added acetic acid. If precipitated is formed, the test result will be positive. For the bilirubin test, we use the early reagents. When added to the urine, we observe for color change. If turned pink, that's a positive result for bilirubin. After discussing all the clinical tests, let's evaluate the test result for this patient. The elevated blood pressure, abnormal CK and LD, and elevated chloride ion suggests potential muscle damage and electrolyte disturbance. The glucose strip and the Benedict region color are within normal ranges, ruling out diabetes as a cause of the symptoms. The normal pH and negative protein bilirubin and Ehrlich test results indicate no signs of kidney or liver dysfunction. The normal ketones levels suggest no immediate concern for diabetes ketoacidosis. Based on the evaluation of the test results, the final diagnosis for the 17-year-old male patient is likely to be dehydration and electrolyte imbalance, possible exacerbated by overexertion during intense football training. Treatment should be focused on rehydration, electrolyte balance, restoration, and monitoring for signs of muscle damage. Close monitoring of the patient's symptoms and vital signs is recommended to prevent further complications. In conclusion, glucose determination, kinetic, and urinalysis are essential tests that provide valuable insights into a patient's health status. By understanding the principles behind these tests, healthcare professionals can make informed decisions, patient care, and treatment plans. Thank you for your attention, and I welcome any question on this important topic. Thank you.